Hello, everyone. Welcome to today's session on Career Status Series with 5 questions. Basically, it's a structured interview where young professionals share their career journey with us. And my name is Funke Ajayi. I'm the co-founder at Career Guild. And with me today, I have Sodiq Yusuff. He plays in the medical space, and I'm sure there's a whole lot to learn. You enjoy your time today. All right, so let's get started. So the first question, so can we meet you, Sadiq? Can you share us through your career journey in the medical field? And even if you've done something extra, outside the medical field, can you just walk us through it?
All right. I'm Dr. Yusuff Sodiq Ajayi,
Oh,
a medical doctor and a public health physician. I've been in the development space for about 2 to 3 years now,
wow.
and I've worked both in both private and public sectors, and I've worked on quite a number of public health projects. The most significant of which is actually micro planning, implementation, monitoring and evaluation of supplemental immunization activities in all the 19 northern states in the country,
Wow.
vaccinating up to about 15 million children.
15 million. Wow.
So it was largely based, I remember then there was a yellow fever epidemic in Katsina then. So that started the activity before we then moved to uh, meningitis and measles and the likes. So in the same vein, I've worked on HIV projects with FHI with the aim to achieve 95, 95, 95. And what does that entail? 95,
Exactly.
95 means that we want we want to accelerate HIV epidemic control. So with 95, 95, 95, the aim is to ensure that 95% of people who are HIV positive uh, know their status. And 95% of those people should be on ARVs, antiretrovirals. And
Okay.
95% or at least 95% of people on antiretrovirals should be virally suppressed. So with that, we believe we can achieve that. Then AIDS might be a thing of the past. So and likewise, I've worked on reproductive health projects in which we try to increase access to contraceptives in rural areas in Osun State. And we're able to reach about 5,000 people.
Wow.
So it has been really interesting. And I'm quite passionate about maternal and child health because Nigeria actually has the highest in the world right now. Because it's said that 1 out of 8 uh, children born in Nigeria will actually die before the age of 5.
Wow.
I mean, that's tragic, right?
Really tragic.
Yeah, so, and that's actually what informed my interests in public health. And financing is pivotal to every area of public health. It's pivotal to it. So I'm interested in health financing, health policy, making, formulating evidence-based policies that can be easily implemented. So those are the keys. Those are the keys. So those are the areas. So that is more all about me. Yeah.
Wow, that is
And
really
I'm interested in
impressive.
public policy in general too.
Oh, wow. Really nice.
Yeah.
Those numbers are really huge. When you're hearing 15 million, you're hearing 5,000. That's really impactful. Thank you for sharing this journey with us. So, what got you started in your career? Like, is it your personality, your interest, or is it that you just wanted to make a change in your community?
Well, I think I should start with medicine, like how
Okay.
I came about medicine. Most doctors will say that, oh, I studied medicine in order to save lives.
Mm-hmm.
Well, I'll be honest with you,
Okay.
that wasn't really the goal then. I just then, if you're a bright student in high school, everybody just assumed that you should study medicine
Yeah,
or law,
right.
stuff like that.
Mm-hmm.
And surprisingly, at home, they didn't want me to study medicine because my older brother was already studying medicine. So, and by then he was already in his sophomore year. But then I just wanted something challenging. I wanted something challenging, not because I was so passionate about medicine. I have lots of colleagues who are like it's medicine or nothing for them. So then, I thought it would be challenging. Well, at the end of the day, it wasn't as challenging as I thought it would be. But trust me, it's the best profession you can find yourself
Oh,
because
wow.
medical school prepares you for basically everything in life. And that's why you see when doctors switch careers, they excel. They don't just survive; they thrive. So,
Hmm.
and in my sophomore year, I wanted to. Then we just finished cardiology, like heart, a course on heart. So I thought by then I would be a cardiothoracic surgeon. Why? I just thought, okay, it will be challenging too. Transplanting hearts, all those crazy procedures. So that's what I thought. Then it was still more about looking for something tasking, not something that's really part of you. Then in my penultimate year in school, I learned about the overwhelming rates of maternal and child mortality in class. And as of then, Nigeria was actually the second in the world.
Now we're
Then
the
in terms
first.
of yeah, now we are the first. We were taking India. So then I decided that I was going to be an obstetrician and gynecologist, and I will put a stop to this menace. However, during the course of my posting, during my O&G posting, I actually realized that this exigent issue cannot be solved within the four walls of the hospital because most of them are actually as a result of weak health system. Uh, so then that is when my interest in public health actually came to fore. And since then, like I said, I've worked on a number of projects since then. And so the goal for me is actually to strengthen the health system. Because at the same time, so one of the major problems with health system in Nigeria is that the poor cannot afford to seek quality healthcare. And this is as a result of out of pocket payments. In countries that work, you don't when you go to the hospital, you don't pay for the service right there. It most times it's through prepayment uh, methods mechanisms. So when you run an out of pocket payment system, what you get at the end of the day is that the poor will pay more than the rich to seek for healthcare, and that is quite regressive. So, and what we should be looking forward to is actually a progressive health financing system where actually the rich pay more than the poor, and healthcare is subsidized for the poor. So those are the things that actually inform my interest in public health.
Wow. So it started with you wanted something challenging, something taxing. I think you're the first person that I'm seeing that wants something challenging. Okay. So from
Yeah,
moving to something that's challenging, you saw a cause that you wanted to solve, a problem that you wanted to solve in your community.
yeah.
That's really good. Thank you for sharing that with us. So we'll go to the third questions. What are the top three things that have helped you accelerate in your career?
Well, I think, like I said earlier, your network is your network.
Mm, true.
Uh, okay, I think I should list them are networking, hard work, and perseverance. Those three things.
Network,
So,
hardworking, and
your,
perseverance.
yes, your network, like we all know, we are all in the development space. And from my experience, actually, um, to get um, to the interview panel in the first place, to get to the seat, most times someone has to recommend you. And people might say, okay, it's nepotism. It's this almost the same thing in developed world. And why? Most times, most of the jobs you get in development space are contracts or like they are based on contracts. And most times, they don't just terminate people's contracts. Do you get? So if you come in, like we are not, you can be as smart as yet you are not conscientious, you are not diligent, you're not diligent. So at the end of the day, you might do it during the interview, and at the end of the day, you get the job and you could not perform to the task. So that's where the issue of recommendation, that's where it comes in. And the fact that you're being recommended doesn't mean that, okay, it's you're just going to get it. It automatically means that you will get the job. That is not really the case. It's more of, okay, to just get it, because so many people will actually apply. So like networking is key to everything, because I remember then while I was looking for a job, I went to see my mentor, and he mentioned three things to me: that to get a job you need three things. It is truly three ways you can actually get a job. Like he said, grace of God. And he was like, at least you can't find your career based on that. It's God. He can do whatever he wants to do. So you're not in charge of that. Then the second one, having a real skill. That even if I don't like your face, I don't have any option than to hire you, because there are not so many people who possess such skills. Do you get? So having real skills. And the third one is networking. It's basically everything. We are talking here due to as a result of our networking skills.
Sure. Mm-hmm.
And when you apply for scholarships, when you apply for grants, most things these days, they will ask you, okay, how do you plan to harness, how have you networked in the past? How do you plan to harness this platform we are going to give you? So networking is everything. To become the president of any nation, your networking skill has to be solid. So that is it. So hard work. As I am, I'm not like, you can't outwork me as a person. Like when I get a job, okay, this is the minimum requirements. I don't dance around the minimum requirements. I go way beyond that. I go way beyond that. And I did my internship. I won't mention the name of the agency. So the funny thing was that there was a plethora of um, programs that they could actually engage intern on. But sadly, interns were largely redundant. They like you could be there, like the people that are made there, the interns that are made there, they have been redundant for about, let's say, 6 months, doing nothing. Like but I asked them, like, no, nothing. They don't engage us and all. And I got the true network, my network. I actually changed that. And at the end of the day, I ended up working in like 5 different core programs of that agency. So, and of course, I eroded the culture of inclusiveness of interns in that agency. And as a result of that, most of those interns ended up working with representatives from development partners such as WHO, UNICEF, Gavi, and the likes. So, but if you're not diligent enough and say, oh yeah, like they don't include interns and you just go along, then nothing might have come out of that. So, like I said, then the third part is perseverance, because you meet a lot of obstacles, regardless of how solid your network is. You will meet it. So, but at the end of the plan might change, but the goal doesn't really have to change. And to me, the way I see life, for every challenge, Jays, like there should be an opportunity. There is always an opportunity, and that's actually what makes it juicy at the end of the day.
Wow,
Yeah.
thank you so much. That's really, really great. One thing I learned is that never settle for less. Even though they tell you, oh, this is the minimum requirement, your boss says, roll out this thing in 4 weeks, but you're rolling it out in 3 weeks. That's really impressive, right? You go high and beyond to get what you want to get done. And then another thing it creates for us is that it makes you explore more. You explore your
Exactly.
strengths more, which is really great. Wow, thank you so much for
Funny thing
that.
is that funny thing is that you would think that people are not watching, like your superiors are not watching, but they actually are.
Mm-hmm.
And when it's time to recommend someone for something, like there's a good chance that you will be picked. And of course, nepotism like is rife in Nigeria, no doubt. Well, we don't really care about results, but when it gets to that point where you need to achieve results, you will be called. You'll be included in core programs.
True.
So that is it.
Yeah, thank you so much for that. So we'll go to the next question. If there's one thing that you wish you learned early enough in your career, what would that be?
Uh, well, I think there are so many things. So do we have to key to one thing or
Just one.
wow. Well, I wish had had a mentor earlier
Mm.
my career, at least from school, because having a mentor actually expedites your career progression. Like, of course, like have it has to be the right mentor, because these are people that they've done it, they've been there before. So what took them perhaps a decade can actually take you a year. And the way mentor-mentee relationship works is not just take, you keep taking. You must be ready to give. But actually having the mentor would have propelled me love like move me forward
Go
better than
further.
where I am today. But I don't regret anything because then when I was in school, I told you I love challenges. I wasn't a fan of those things that okay, I can do it all by myself. Well, that was quite naive of me though. It was. But having a mentor goes a long way. The right one.
Great. Thank you
Yeah.
so much for that. The final question, what can you just share one word with young graduates out there? Young graduates, young professionals.
Well, what I can say is that while the going might be tough right now, uh, they should ensure to be, they should persevere and at the same time be intentional about their goals. Like you must be intentional about your goals. That is just you meet obstacles, and like I said,
Mm-hmm.
that's what makes it interesting at the end of the day. If you are starting out, particularly in the development space, the way it's structured. Say, as at the time I was interning, I I was earning just 30K per month as a medical doctor. Like my colleagues were earning, they were combining two jobs, earning to about 250 to 400 per month then. Like it was quite ridiculous to them then.
Very
Really,
ridiculous.
like that. Yeah, what are you doing? Like, well, now you sabi, like you're the one that knows because actually public health is not like they believe like it's for the dull ones in medical school. Do you get in a sense? Like we used to call it back then in school, komobe. Like it's more like soup. It's
Mm-hmm.
so easy. That was the mindset people had. Do you understand? So
Yeah.
you make sacrifices, but at the end of the day, while making those sacrifices, just ensure that you are strategic and intentional about whatever you do. It goes a long way. And for people in sciences, particularly those ones that are still in school, or the ones that are just getting out, I think the greatest disservice you can do to yourself is not to publish your final year uh, project, your final year research work. For like I said, for people in sciences, I can't say much for people in
Social
in all that
so
the social
arts,
sciences and the rest.
administration.
But for
Yeah.
people in sciences, it goes a long way. Whether you're applying for grants, you're applying for scholarship, you're applying for jobs, like having publications, it goes a long way because if you want to compete on the global stage, like the people you are competing with, most times they have like 3, 4 papers in reputable journals already. Why you are like they just call me like okay, like you finish with 2-1. Oh, fantastic! There are so many people that actually finish with 2-1.
But what will
So
stand you out?
like what exactly? But I thought like if you have published 1 or 2 papers, like now you're let's say that you are a microbiologist, whether a student or you just graduated from school, and you know okay you want to develop the new vaccine, the new COVID-19 vaccine. That's what you're thinking. I think okay it's not possible for me to achieve this in Nigeria in a sense. Then okay you need scholarship You don't just go there and start. Right? There is one, I'm sure there will be one lecturer in your faculty or department working on something. You join such people because that was the best time. Like the thing is this, as a medical student, you actually, if you want to publish up to 5 papers before you finish from school, before you medical school, it's possible because you have access to lots of lecturers in school. You have access to them, to senior registrars who are publishing. So, but like nobody told us then, and we so we just could not uh,
Couldn't see it.
maximize that opportunity. We couldn't maximize that opportunity, and it's so if you are in sciences and you want to get ahead, you want to apply for scholarship, you want to be in development space, publish, publish. It goes a long way. It goes a long way.
Wow.
Yeah.
Wow, thank you so much for coming around, Sodiq. I have learned a whole lot from you. Thanks for sharing. And I'm sure a lot of science students, and even those that are not in sciences, will learn a whole lot from what you've shared with us today.
Yeah. People that are not in sciences can actually publish. People in social sciences, sociology, psychology, there are lots of things around mental health now. So definitely.
True.
So
and it even looks like most of these courses are already getting intertwined, sort of.
They all are, like if you look at the SDGs, like I think the first one is on poverty, if I'm right.
Yeah, poverty.
The second one is on hunger. The third one is health. The fourth one is education. Now it's interrelated. Like it's most times like now maternal mortality rate is quite high in rural areas. And what are the things that are peculiar to rural areas? Illiteracy, poverty, lack of access to care. So they are all related. So you can say number one, poverty. Number two, hunger. And if a child is malnourished, he or she cannot fight any infection. So it comes down with diarrhea and all sorts. So everything is intertwined. So we can't do without one another. Because now if you are drafting a policy you want to work, you have to look at the socio-economic determinants of health. And what are those things? Illiteracy, the GDP of the country, and all those things. So you can't, everything is interrelated.
True. Wow, thank you so much, Sodiq. I really enjoyed this session with you.
You're welcome. It's a pleasure being here.
Yes, so thank you so much. So do have a nice day ahead.
Yeah, you too.